I see patients with hip pain quite frequently for evaluation for the option of a hip replacement. Most patients that are referred to me for hip pain, it's usually because of osteoarthritis. I also see patients that have hip conditions such as post-traumatic arthritis, who've had an injury in the past and have gone on to develop a bad hip. There's other diseases that can affect the hip joint, which require it to need replacement as well. There's been recent advances in hip replacement. Half the advances are in technique, the other half are in materials. The technique is less invasive. It takes less muscle cutting to actually get the implant in, which provides for a faster recovery. The materials have advanced. The bone ingrows to the prosthesis better now. Materials wear better, they wear longer, which provides a longer life of the implant. The typical materials are a titanium stem, which is the part that goes in the thigh bone, and then a plastic socket, which is the part that goes in the pelvis. If a patient has two bad hips, we do not replace them at the same time. We generally like to have one strong hip that they can recover on, but we can stagger them as soon as 12 weeks apart and give them two brand new hips. Our hip replacement patients receive patient education both before and after surgery. Before surgery, we offer a patient education class. It's a joint replacement class, which answers a lot of the questions that patients would have or will have about the procedure and about what to expect. After the surgery, we have patient education in the patient's room in the hospital before they go home. And if needed, we'll continue the education while at home. The recovery time for a hip replacement is about 6 weeks, anywhere from 6 to 12 weeks. However, the pain that the patient was having before the hip replacement goes away within 1 to 2 weeks. The rest is recovery of the muscles, of the function and the strength around the joint. Once the patient is completely recovered from hip replacement, we expect them to be able to do any normal activity of daily living. If somebody's in chronic pain from their hip and we determine it's actually from the hip joint and not from another cause, then we'd expect the pain to be completely gone with the hip replacement.